Good afternoon. We'll now start. So first of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. Reminder, please take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box. Another reminder, passing or getting 50 OLETE certificates will entitle one to get a free voucher for a RO Hoson telemedical consultation. Another request is that please type in your feedback in the chat box during the open forum and before we part ways. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your beautiful faces. Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021, 2 years ago. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fatty Liver. Fatty Liver. Okay. The empowerment objective is for the lay people to have an essential understanding of fatty liver in their health management. I suppose most of you have heard about fatty liver already nowadays. The contents of this particular pep talk will be the following. What is a fatty liver? We will define that. What are the different types of fatty liver disease? What are the causes or what is the usual takbo ng sakit ng fatty liver? What are the causes and risk factors for fatty liver diseases and how to diagnose? What are the treatment and preventive measures for fatty liver disease? And then a very important question is, are supplements recommended for fatty liver disease? And what is the prognosis? What will be the outcome if one have a fatty liver disease? So these are some of the basic information that we want to impart in this particular pep talk. Let's start with what is a fatty liver. A fatty liver is defined as a condition in which extra, hindi naman kailangan extra, or too much fat is stored in the liver. Okay? So too much fat is stored in the liver. So when you say too much or extra, it's assumed that there are some fat in the liver, but it should be in the right amount and in proper quantity. So when more than 5 to 10% of the liver weight, yung timbang ng liver, is composed of fat, taba, then it is called fatty liver. Fatty liver. Okay. So the other names for fatty liver will be fatty liver diseases or disease. A more technical term will be a steatosis, which is the mildest form of fatty liver is steatosis, and the other one is steatohepatitis. This is the more severe form of fatty liver. Okay. So after fatty liver, there is still this can progress to other types of diseases like cirrhosis, like fibrosis, and eventually it can lead to liver cancer. So I really don't know what is the Tagalog term for fatty liver. You tell me later on what could be a good Tagalog term for fatty liver. What are the different types of fatty liver disease? Basically, there are two general types, the non-alcoholic and the alcoholic. Okay. Just by the name itself, when you say alcoholic fatty liver disease, it is seen in people or in patients who drink a lot of alcohol. So the moment you have a fatty liver and then the patients or the person is drinking a lot of alcohol in the past or even at present, it is called an alcoholic fatty liver disease, or the fatty liver disease is caused by the alcohol. But in the absence of the consumption of alcohol by a patient, the moment a person develops a fatty liver, we call it non-alcoholic fatty liver disease. Okay, so there is a buildup of extra fat in the liver, but this is not associated or caused by the alcohol. So remember the two types, alcoholic and non-alcoholic fatty liver disease. Which one is more common? Okay, let's talk about the prevalence first. In the world, I think it's only in 1979 that attention were focused on fatty liver. Before it used to say, baliwala yan, baliwala yan. No? So starting 1979 or a little earlier, the world has now becoming concerned with the so-called fatty liver. So nakakasama pala yun. No? So in the world, the non-alcoholic fatty liver disease, 25% ang prevalence all over the world. Na-compute nila yon. No? In the Philippines, there's a small study which is not very accurate, but they come out with a small study few years ago, and it shows that we have a 35% prevalence in the Philippines. It could be higher. No? Okay. So between the two, alcoholic and non-alcoholic, more likely, again, we don't have much data, but more likely, the non-alcoholic will be more common than the alcoholic fatty liver disease, because the non-alcoholic fatty disease is also associated, or the risk factors are the diabetes and obesity, which are very common in the community or in the country. And we know that it has been said that when you have diabetes mellitus, the prevalence of fatty liver disease is 57%. Mataas, no? Okay. So when you have diabetes mellitus, it is a risk factor for a fatty liver disease. So between the two, I would think that non-alcoholic fatty liver disease is more common. And that's why most of the articles that you see in the internet or in the social media will be focusing on the non-alcoholic fatty liver disease. What are the different types of non-alcoholic? The first time, non-alcoholic fatty liver disease. Basically there are two types: the so-called simple fatty liver, or the medical term is steatosis. Wala pa yung hepatitis. The other type will be the more advanced one, is the so-called non-alcoholic steatohepatitis. So just remember this: simple fatty liver, that's steatosis, and then non-alcoholic steatohepatitis, that's more advanced. Okay. So in the simple fatty liver, which is the earliest stage of the disease, okay, there is still no damage. Wala pang sira sa liver cells. Hindi pa tinatamaan. Okay, kung meron man, just starting, baka it's still reversible. Okay, so Usually, the simple fatty liver does not typically develop into a more severe medical condition unless if left unchecked, not controlled, it can progress. But pwede pang i-reverse yan. Okay. So for the other type, which is the more severe form, steatohepatitis, there is inflammation. Meron nang nasisirang cells sa liver. Okay. As well, of course, the assumption is may fat. The fat are causing the inflammation and damage to the cells. So the NASH can progress into more serious conditions such as liver fibrosis, cirrhosis, liver failure, and liver cancer. Okay. So I will enlarge this one. Okay. Okay. So these are the stages of the liver damage. So healthy liver, medyo maganda ang tsura, medyo a little brownish, reddish, no? And then medyo, when you have fatty liver, simple fatty liver, you call it hepatic steatosis. Okay. Okay. Kung nag-progress pa, if you don't control it, if nag-progress pa, magiging steatohepatitis or NASH. Okay. At this stage, is still reversible. No? So, kailangan ma-reverse kagad ito. Kung hindi pa ba makontrol ito, it can go to liver fibrosis or cirrhosis. Okay? Yan ang pinaka serious na stage. No? So, once you have cirrhosis, essentially, it's not reversible anymore. Okay? So, again, healthy liver. Okay, the first stage of liver damage in terms of fatty liver is the so-called hepatic steatosis, which is still reversible. Iko-control lang. And then, kung di makontrol, it can progress to steatohepatitis or NASH. And then, kung di pa rin makontrol, this can still be controlled. But hindi pa i-control, it can lead to liver cirrhosis. So this is another illustration of this non-alcoholic fatty liver disease. Okay, from healthy, non-alcoholic, nakikita niyo 2 arrows, is still reversible. And then, if you don't control it, if you don't know what's going on, and then it progressed to a steatohepatitis, is still reversible. But if you don't control it, it can lead to cirrhosis. Okay. Okay. Actually, there's a step parito. It's called fibrosis. Now, for alcoholic fatty liver disease, basically it's due to the excessive intake of alcohol, okay, which can result in liver cell damage and inflammation. Kaya huwag tayo iinom ng masyadong maraming alcohol. Okay. So, if the person stops using alcohol, it pwede pang ma-reverse. No? But if it's tuloy-tuloy pa rin ang abuse, excessive intake of alcohol, then the liver can lead to alcoholic hepatitis and eventually to cirrhosis. So ito, no? Okay. Healthy liver tissues, then becoming masyadong maraming alcohol, fatty liver, alcoholic fatty liver, and then pag at hindi pa rin pag-inom ng alcohol, it can cause hepatitis and then eventually cirrhosis. So this is another illustrations of that disease, the course, starting with normal liver, healthy liver, okay, with all the causes coming in, alcohol and non-alcoholic causes, then you can have fatty liver. And then when fatty liver is not controlled, it can go to liver fibrosis, no? Meron pang isang stage ito. There are 2 types here, the simple and then the steatohepatitis, and then after that magiging fibrosis. Fibrosis is maraming peklat, maraming yung mga cells na parang hindi na parang sugat na hindi na may babalik sa dati. Then eventually cirrhosis. So cirrhosis is the most serious stage of liver disease. Ito is cirrhosis. It typically occurs when scar tissues, okay, sinasabi fibrosis, scar tissues, replaces the healthy liver tissues. Pag scar na, hindi na gumagana yung liver in terms of its functions. So it can lead to liver failure and eventually liver cancer. Okay. Again, just show you this picture. Okay. It can, once you reach the stage of liver cirrhosis, it can lead to liver failure kasi wala nang natitirang normal, wala nang natitirang adequate amount of liver cell to help the body in terms of its metabolism, kaya magka-fail ang buong katawan. That's why we call it liver failure. And then the other possible complications when you have liver cirrhosis, it can lead to liver cancer. So what are the symptoms? Usually walang symptoms ang early stage of fatty liver. Wala kang mararamdaman. Okay. So kung meron mang symptoms, it's usually non-specific, baka tired ka, no? Palaging pagod, no? May medyo masakit, may discomfort sa right upper quadrant kung nasaan ang liver, pero hindi mo, it's not very specific, no? Okay, hindi mo masasabi kung talagang kung galing sa liver, no? Based on the symptoms. But eventually, if the fatty liver disease progresses to NASH or even to fibrosis and cirrhosis, then you will have more specific symptoms. Okay? So kung more advanced na yung sakit sa liver, you can have itchy skin because of the buildup of the bile, yung mga bilirubin, bile, and then easy bruising or bleeding because wapasok na yung liver failure, bloating in the abdomen, most likely may mga tubig na yan, kaya bloated, no? And then jaundice, naninilaw na yung mata or skin of the patient. Okay, so once you have jaundice, ito yung pinaka-reliable na alert sign for a liver disease already. Okay, the rest are non-specific, and then ito, non-specific pa rin ito kasi anything can cause itchy skin. Anything can also cause bruising and bloating of the abdomen. No? What are the causes and risk factors for fatty liver disease? And at the moment, the cause of fatty liver is not entirely clear, okay? Because it could be genetic, it could be environmental, no? But we know that these are the following risk factors. Genetic is one factor which we cannot avoid, which we cannot really prevent, no? And then overweight or obesity is another factor that can lead to fatty liver. Hypertension can also lead to fatty liver. Type 2 diabetes mellitus can also lead to that. And then the so-called metabolic syndrome, which is a group of medical conditions and characteristics linked to obesity, specifically yung mga triglyceride, cholesterol, etc. Okay, or this lipidemia ang tawag doon, no? Okay. So genetic is one possible factor. Okay. Most of the time we see this one: overweight, hypertension, diabetes, and yung mga high fat, high cholesterol in the body. This is an illustration, pictorial infographic of the causes of liver. Genetic inheritance. Okay. Wala tayong magagawa doon. Okay. Okay. Then obesity, rapid weight loss. If you have to lose your weight, which is one of the strategy against fatty liver, okay, lose your weight gradually. Wag masyadong mabilis. It has been shown that rapid weight loss can cause fatty liver also. Okay. And then diabetes, and then fats, yung mga cholesterol, triglycerides in the blood, then of course, yung mga medications like paracetamol, which is notorious, no, for side effects on the liver. No? So paracetamol, if taken in excess, can also cause fatty liver. This is aside from paracetamol, marami pa rin gamot yan, which can affect the liver. As I said, symptoms, usually none, so it's hard to diagnose, how it's really difficult to recognize, especially if the patient is asymptomatic. But if you're suspecting that you have fatty liver, you can do one of several of these tests. Ultrasound, okay, the conventional one, I think most of you have undergone ultrasound. That's a conventional one. Now, if you really want to have a specific test to check the amount of fat in the liver, you can do the so-called FibroScan. This is available in the Philippines. Medyo mahal lang, okay? FibroScan. Okay, when you say FibroScan, it's scanning for fibrosis in the liver. Nakita niyo itong picture, liver fibrosis, no? So it will try to determine the amount, the degree of fibrosis. Pag meron ng mga degree of fibrosis, yun na yun. It's a more advanced stage of fatty liver. Now, the liver function test like ALT, AST, or the so-called SGPT, this is SGPT. Mahirap matandaan yung different terms. SGPT, SGOT. Okay? Okay? So, kung mataas ito, it might signify that you have fatty liver. Okay? Then, the most accurate but not 100% is that you have to do a biopsy because titingnan nyo kung gaano karaming fat in the liver. Okay? So, ito yung direct way of looking at the sample, at the specimen from the liver. Titingnan nyo kung gaano karaming fat. Kung may makikitang fat in the liver cells, then that's why this is what we call the most reliable. But as I said, it's not 100% accurate. No? Okay. So these two are very shadows, image lang ito eh. No? And then, ito yung liver function test, may mga other causes of other diseases that can also cause increase in the ALT and AST. Okay. So you need a medical doctor to interpret it for you. Then we have to correlate everything sabay-sabay. No? So most of the time, we don't do needle biopsy because it's very invasive. No? So most of the time, we just rely on these two. Okay? Ultrasound and liver function test. So ito yung sample ng ultrasound that is commonly done. Okay, the conventional one. So usually they compare yung echoes on the liver. No? Ito yung, when you say, kasi ultrasound uses echo on the organs to come out with a picture. No? So kino-compare nila yung echoes that is seen on the liver and the kidney. Kung pareho lang yung degree of echo, it's normal. No? Pero kung maputi, mas maputi yung liver kaysa yung sa kidney, they call it fatty liver already. Okay, hyperechoic siya, no? Okay. So just tandaan na lang, mas maputi siya, kaya that's the basis for saying that it's mas maputi compared to the one on the kidney. Yan ang comparison niya eh, no? Kaya as I said, a little subjective yon, no? Pero at least it will give us some clue that one may have a fatty liver, mas maputi, no? Okay. Now, pag baku-baku ito, yung gilid nito, yung mga border nito, then you might have cirrhosis already, cirrhosis or fibrosis. No? Okay. This is just a picture of a FibroScan. May special equipment ito. A vibrator, transducer, and then it will produce some sound waves to determine the degree of fibrosis. No? Okay. Yung hardness of the liver. No? Okay, so this is more accurate, but it's very expensive. So what are the treatment for fatty liver disease? What are the treatment? Basically, it's lifestyle changes, okay, and prevention after you have instituted it. Okay, prevention of fatty liver and then lifestyle changes. So making a lifestyle change is essential in treating fatty liver. Ito yung pinaka-importanting recommendation, not drugs. Ha? Okay. So the lifestyle changes will include the following. Number one, abstain from alcohol. Kung pwede, wala na lang. Kung iinom, konti-konti lang. No? Okay. Now, eating a balanced diet. We have talked about this in the past. Balanced diet, you can have a proportion of carbo, protein, and fat, no? And then ibabari lang yung mga pagkain in one food group, okay? Huwag pare-pareho. And then the other strategy there is eating in moderation, okay? So essentially, as a rule, you can eat anything you want to eat, but eat it in moderation and vary it. Huwag pare-pareho, okay? And then the other most important strategy in trying to avoid fatty liver is doing regular exercise, okay, to keep your weight down, to prevent obesity, okay, and then avoid unnecessary medications, okay. Medications, drugs can also cause if you take in a lot of supplements, unnecessary supplements, the mga yung mga naririnig ninyo, and then you also take a lot of medicines for your other diseases, which as doctor will tell you may possible side effects. No? So it can also cause fatty liver. Okay. So basically, these are the 4 strategies. Okay. Abstain from drinking alcohol. Most likely, madali-dali yan, di ba? Kasi ako, hindi rin ako masyadong umiinom, di ba? And then, avoid unnecessary medications. No? Medyo madali lang ito if you, basta huwag kayo magiging drug addict na dependent on too much medicine. No? Kung di naman kailangan, huwag kayo uminom. No? Okay. And then, of course, ito yung pinakamahirap na gawin. No? Okay. It takes a lot of discipline, no? Perseverance to do this. No? Eating a balanced and diet and eating in moderation, doing regular exercise. No? Every day ito, every day. Now, when earlier I talked about treatment, yung preventive measures are the same. Pareho lang, okay? So lifestyle changes lang. Or when you say pwedeng walang lifestyle changes or maintain a healthy lifestyle. Kung from the very start, maganda na yung lifestyle mo, i-maintain mo lang, no? Kung masama ang lifestyle changes mo, kung may mga faulty lifestyle mo, then you change it. Example, if you're drinking a lot of alcohol, mag-abstain ka na. Okay? If you're not eating a balanced diet, i-balance mo. If you're not doing exercise, mag-exercise ka na. No? Okay? Medications, ganun din. Okay? If you're taking a lot of medications, try to remove some o yung mga hindi kailangan. No? Okay. So, ito yung pinakamadalas tinatanong. Are supplements recommended for fatty liver disease? No? Hindi lang tinatanong mga pasyente, hinahanap ng pasyente, yung mga doktor naman, prescribe, no? Just to satisfy the patients para wala na masyadong tanong, magre-reseta na lang. No? At the moment, okay, this is not only my stand, but also the stand of the gastroenterologists, yung mga expert. No? Kasi before this lecture, I tried to listen to the expert, the gastroenterologist ang expert dito. No? So they are one in saying that supplements, which are popularly known as liver vitamins, you have heard about it, liver vitamins, okay, have not been proven by scientific evidence to be effective in treating fatty liver disease. Yeah, they don't really recommend that. No? So take note of that. They are not effective because up to now there's no proven scientific evidence. No? So ito yung caveats nila, precaution nila. If you take it, now you're deviating from the most important strategy of avoiding fatty liver, which is essentially exercise, lifestyle changes, and weight loss. Okay, so sabihin, ay mas madali pala uminom na lang, huwag na mag-exercise. No? So ito pa rin ang pinaka-crucial part of the strategy. No? Weight loss, exercise, lifestyle changes. Okay. And then for those who have diseases like hypertension, diabetes mellitus, high cholesterol, no? Aside from the diet, no? You may have to take some medications to control them. So what is the prognosis of fatty liver disease? So what is the outlook? The most important risk factors for fatty liver, as we said, is related to obesity and overweight. Okay, that's the most common factor aside from this diabetes, hypertension. Okay, so taking steps to lose weight through diet and exercise can reduce the risk of developing fatty liver. So this can also be a way to reverse liver damage or halt the progress of the disease. So once you have a fatty liver, mild pa lang, mag-exercise ka na, mari-reverse pa yon. But once the fatty liver disease has progressed further into fibrosis or hepatitis, fibrosis, no? And then, mas mahirap na gamutin. Okay. Again, this is an important slide that shows healthy liver. Okay, if you don't have a good lifestyle, then you develop hepatic steatosis, but this is reversible. So try to get back to a healthy lifestyle. If you get into the stage of steatohepatitis, pwede pang ma-reverse, get back to a healthy lifestyle, no? Okay, para ma-reverse. Okay. Kung hindi mo pa magawa yon, if you're not very particular about healthy living, then you might develop liver cirrhosis, which is now irreversible, and that's the end. No? It's just a matter of time. You'll develop liver failure, and sometimes liver cancer, and then eventually die from the original cause, which is the fatty liver, and then eventually it will be the liver cirrhosis or the cancer. Okay. So summary and takeaway, I have discussed all these things. What is fatty liver, different types, courses, okay, ang takbo ng what is the usual progression of fatty liver, and then what are the causes, risk factors, how to diagnose, what are the different treatment and preventive measures, are supplements recommended for fatty liver, and then what is the prognosis. Okay. So in statement terms, okay, non-alcoholic fatty liver disease and alcoholic fatty liver disease occur when fat builds up in the liver. Okay. This can cause the liver to stop functioning correctly. Fatty liver disease is often symptomless. Wala kayong nararamdaman, especially if it's mild. If the liver disease progresses and develops into cirrhosis, now this is the time you may experience jaundice, paninilaw, itching, and swelling. The cause of fatty liver disease is not exactly known, but we know the risk factors. Okay. The treatment is not straightforward, but a person can help prevent fatty liver disease by maintaining a moderate weight, taking regular exercise, and not using alcohol to excess. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on fatty liver. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself by knowing fatty liver in one's health management. So with that, I end my pep talk for today. I hope I have empowered you to have a better understanding of fatty liver in your health management and how you can stay healthy. So before we go to the QA, okay, as a reminder, please take the online Learning Kung evaluation test exercise for Mastery of Learning and get this certificate. And then 50 OLETE certificates will entitle you to 1 voucher for a free medical consultation. Then request again, write your feedback on the chat box during the open forum before we say goodbye to each other. So let's now have a group picture taking, the second one, before we start the QA. Okay. Ready? Okay, everybody in the picture now. 1, 2, 3. Good. Complete tayo. Okay. So the floor is open to questions, comments, sharing, okay, recommendations, etc., etc. Okay. Anybody wants to talk first? How many have been diagnosed with fatty liver before? Show of hands. Okay. Isa pa lang? Good. Isa pa lang? Oh, dalawa na? Ilan? Si Lorly?
Opo.
Oh, dami ah. Sino? Si Rochelle, Jocelyn, at 4 na. Okay. Would you like to share your experience? How was it diagnosed? And what's your status right now? Phoebe? Phoebe, can you start? Unmute, unmute. Unmute. Ayan.
Last year when I have an ultrasound, nakalagay
Ano
yung
na?
full abdomen, fat liver. It's fat liver.
Oh, ultrasound.
Yeah.
Yes.
Yes, Doc.
And then,
Ultrasound ako, fat liver.
okay. So, anong nangyari?
Hanggang ngayon di pa ako nagpa-ultrasound ulit.
Okay.
But I think kasi medyo diabetic ako. Tapos yung aking iniinom ko mga medicine, diba, ang drugs, sa high blood,
Okay.
esterol, medyo obiso ako ng konti.
Okay. Naamin mo yan.
Oo. Obese naman. Totoo yun. Although, konti lang naman ang kinakain ko. I don't know. I reduced my, nag-reduce naman ako ng mga kinakain ko. I am on diet ngayon. Siguro I have to undergo again the ultrasound
Okay.
for the whole abdomen.
Okay. That's good. Ilang years ka na cancer survivor sa breast cancer?
15 years na po.
Okay. Wag mo
Yung
sayangin
sa
yan.
una.
Wag mo sayangin yan na naka 15 years ka na, baka may mangyari ka pa sa fatty liver.
Ay, hindi man, Dok.
Ingat ka lang sa fatty
Kasi mahilig ako sa gulay. Iwas ako sa mga taba.
Okay. So,
Fish and vegetables po eh.
Okay. Usually, yung fatty liver is recognized, commonly recognized through an ultrasound. Kasi very common ang ultrasound, and also kayong yung mga mahilig na magpa-blood chem, di ba? Blood chem, di ba? Palagi may blood chem. May mga,
Ay, ganun ba doon?
parang executive check-up, and then yung mga doktor ninyo madalas yung mga laboratory nagpo-promote, sige, may package deal, no? Mas mura, mag-ano kayo, mag-blood chemistry kayo, di ba? So,
Yes.
so along the way, nadidiscover na meron kayong fatty liver, di ba? Pero wala kayong nararamdaman usually.
Wala.
So, lalabas yan sa ultrasound, fatty liver, no? Okay. Ngayon, kung meron kayong liver enzymes na ginawa, ibabangga doon, no? So, kasi pwede yung liver enzymes nyo, yung SGOT, SGPT, pwedeng normal, no? Pero yung ultrasound, fatty liver, sasabihin ng ultrasonographer, no? Okay. So, anong gagawin nyo? Ang gagawin nyo lang ninyo, just control your diet, exercise, gano'n, no? Okay. Okay. Wala ka na magagawa kasi na-report na eh. Di ba? Na-report na may fatty liver. No? Tanggapin mo na lang muna.
Yun lang.
So, it's hard to
mahirap. Lang exercise.
It's hard to argue against the report, di ba? So, tanggapin mo na lang kasi kung gusto mo, kung ayaw mo maniwala, paulitin mo sa ibang facility, baka sasabihin nila normal naman, di ba? Kasi a lot of times subjective din yung mga ultrasound report, na? Okay. So tinitingnan nila kung mas maputi, ganun lang naman, maputi o maitim, no? Ganon, no? Okay. So ang suggestion ko, just go for healthy lifestyle, no? Try to avoid yung mga medications na hindi mo kailangan, tanggalin mo na, no? Kung piliin mo na lang yung mga kailangan, no? Okay?
What about yung mga supplements, Doc?
Hindi nga kailangan, sinabi ko na. Sinabi ko na, hindi kailangan.
Hindi na kailangan.
Oo, kasi yung mga gamot na yan, yung mga gamot na yan can also cause fatty liver pag hindi kailangan. Na? Okay? Okay.
Mga
Thank you.
vitamins naman yung Dok eh.
Vitamins, may
Yung mga
mga
vitamins.
lahat ng papasok sa bibig mo may possible side effects. Pagkain lang meron. What more, yung mga chemicals na papasok, parang processed food din yan eh. Di ba?
Okay.
Okay.
Okay, Dok.
Tandaan mo,
Okay, Dok.
think of it that way kasi ang thinking ng ang majority ng mga tao ay vitamins yan. It's good for health. No. No. May mga side effects din yan. No? Okay.
Okay.
Okay? Tandaan mo lang,
Okay, Dok.
kahit anong masarap ang pagkain, kain, di ba? Sabi niyo, magandang kumain para lumakas, malusog. Merong side effects ng pagkain eh, di ba? Tama?
Dok, tama, Dok.
Okay.
Okay,
Tandaan.
Dok.
Okay. Okay. Who else would like to share? Rochelle, ikaw ba? Meron? Rochelle?
Hi, Doc.
Hi.
Rochelle here. Opo.
Can you share?
Yung sa akin po kasi, Doc, mga 2 or 3 years ago, lumabas din siya sa ultrasound of the abdomen.
Yeah.
Nakalagay po sa ultrasound, fatty liver talaga. And then, December 2021 and then December 2022, when I had my ultrasound again, nakalagay normal liver naman na. So, wala nang nakaspecify na fatty liver.
Okay.
So, kaya lang, Doc, yung question ko po, yung ALT ko tsaka yung AST, yun yung slightly elevated.
Okay.
Despite the normal ultrasound, meron pong lumabas na elevated yung ALT ko tsaka AST.
Okay. Paano natin interpret yan?
Hypertensive ako, Doc. Hypertensive ako, so umiinom ako ng mga yung gamot meron ako maintenance.
Okay. So ipa-prioritize mo na lang ha. Usually ganun na prioritize. Hypertension is more a priority over yung so-called fatty liver, di ba?
Opo,
Okay.
opo.
So, pero i-analyze natin yung fatty liver mo kung talagang meron ka, di ba?
Opo.
Okay. Or what you can do is just assume meron ka. No, just try to maintain your healthy lifestyle, no? Okay? To avoid its progression, no? Pero i-analyze lang natin, ha? Just for the sake of, para may matuto tayo.
Yes, please, Doc.
Kasi we have been talking about yung mga subjectivity, yung mga, minsan nagbabari yung mga reports, di ba? Mga reports, yung mga reports ng ultrasound and even yung mga blood chem, di ba?
Yes,
nagbabari. So when do you believe it? When do you accept it as significant, no? So first of all, yung ultrasound mo, ilang beses, 2 beses ginawa, 3 beses?
Once lang po, Doc, pero every year po kasi siya. So,
okay, yeah, once a year.
Once a year po, opo.
So kailan lumitaw yung
fatty liver? I think it was 2-3 years ago, Doc.
Okay. Then after that, the year after, fatty liver pa rin?
Hindi na po, Doc. Hindi
Okay.
na po. I understand, kung maalala ko po mabuti, the fatty liver came out nung hindi pa po ako nagme-maintenance medicines. Tapos doon po ako na-diagnose na hypertensive ako. That was the year, Doc. I think it was, 3 years ago, Doc. Kasi 3 years na po ako nagme-maintenance eh.
Okay, so before nag-maintenance ka ng anti-hypertensive.
Sa hypertension, apo.
Okay, so but after the first report, the next year, normal na.
Opo, Doc. Opo.
Up to now.
Opo. Hanggang ngayon po, Doc, sa per ultrasound, ha?
By ultrasound.
Opo.
Okay, just based on the ultrasound, most likely wala. Baka baka may konting baka may error lang doon sa reporting ng radiologist, no? Baka masyado siyang mahigpit sa iyo, no? Binas yan. Kasi depende sa nagbabasa yan eh, di ba? Parang meron, parang wala. Kung minsan, kadalasan sabihin, lagyan natin, meron na lang. No? Ganun usually yung style ng mga doktor, no? Okay? Overreading, tendencies to overread, no? Okay. So, pero during that time, yung alkaline, yung ALT, kailan tumaas yung ALT mo?
Itong taon na to, Doc, yung December 2022 ko na before tumataas din siya pero the next test kasi dati every 6 months pinapamonitor yung ALT ko when it was discovered na tumataas. Nagno-normalize naman siya, Doc. Pero itong last December, mataas na naman siya.
Pero yung taas niya, gano'ng kataas?
About 30 points higher, Doc.
30 points.
Opo. Yung AST ko kasi, Doc, is 50. Ang nakalagay po sa normal values hanggang 36 for female. Tapos yung ALT ko po, 72. Ang sa female po hanggang 35.
35, Doc.
Opo.
Okay. So, mahal lang naman ito, okay? Pero question is, yung series, serial, no? So,
Opo.
I suppose you have, pero nagpa-fluctuate yan, di ba? Up and down, up and down.
Opo, Doc. Fluctuating po.
Na normal, pumupunta sa normal.
Yes, Doc. Nagno-normalize siya, tapos may mga times po na tumataas. Kagaya po last December, mataas siya.
Okay. So, I like to say that in my opinion, as I still hold yung opinion ko na fluctuate kasi palagi yan no? Okay. Kung minsan may hilo ka sa mga report na ngayon di ba? Hindi mo malaman kung anong susundin, di ba? So, pero pag naging 3 times, 4 times higher at persistent, no? Doon ka na matakot. Pero kung nagka-fluctuate, ay baliwala yan. No? Okay. Okay. Kasi kung ibabangga mo rin sa ultrasound mo, once ka lang na-read na meron, di ba? Okay.
Yes, Doc. Ako.
The rest, yung sa ALT mo, AST mo, nagpa-fluctuate up and down, di ba?
Yep.
Most likely wala. Most likely wala, no? Okay. Okay. So, but just take the necessary precaution. Just hold on to your practice of healthy lifestyle. Yan na lang, no? Okay.
Okay, Doc. Okay po.
Yan ang general recommendation sa lahat, okay, which I uphold, no? To prevent diseases, no, just rely on the healthy lifestyle because it can contribute to 85, sometimes depende sa sakit, kasi yung mga genetics hindi natin makokontrol yan. You cannot say healthy lifestyle can control the genetic diseases, di ba? So yung mga genetic diseases, konti lang naman yan, mga 5-10%, no? Okay? But if you go for healthy lifestyle, probably you can avoid a lot of diseases in the proportion of some would quote it at 85%, 90%, or 70%. No? Okay? So just stick to that. No? Healthy lifestyle. No?
Okay. Opo.
Healthy lifestyle and ano tawag doon? Activities. No? Exercise, diet. No? Ganon. Basically yan exercise and diet. No? Okay?
Opo.
And of course, I suppose you're not drinking alcohol, di ba? Okay.
Hindi po. Hindi po, Doc.
Okay. Very good. You're on the right track. Okay. Sino pa? Who likes to
Thank you,
share?
Doc. Thank you so much.
Welcome. Who else would like to share? Jocelyn? Wala na si Jocelyn. Jocelyn left. Who else? Who rose? Sino nagtaas ng kamay? Si Lordly? Lordly? Oh, ikaw rin, may fatty liver na diagnose ka?
Opo, Doc, nalaman ko lang nung hiningan ako ni Doc doon sa PGH ng ultrasound sa Nalaman ko lang yung fatty liver ako doon sa ultrasound.
During the because of your
chemo po.
Nagkikimo, di ba? To
Opo,
check you kung merong sa liver, kung may status ng liver mo, no? Okay.
Opo.
So once lang?
Opo, Doc.
Wala nang
sabi lang, opo, wala na po. Sabi lang ni Doc dati, mag-diet lang daw po ako.
Okay. Pero hindi na inulit?
Hindi na po.
Wala nang naulit?
Okay na pala daw. Hindi, wala na.
Once
lang po.
Once ka lang nagpa-ultrasound?
Opo.
Okay. Sige, just ganun na lang. Kasi kadalasan, makakatakot yung may isang report na ultrasound na fatty liver, di ba? So, anong gagawin nyo? Matataranta kayo, di ba? So, ang suggestion ko, kung wala naman kayong nararamdaman, usually wala kayong nararamdaman, just get back to your healthy lifestyle kagad. No? Okay. Just assume na lang ninyo, baka meron kayong pumaltos kayo sa healthy lifestyle, balik kayo sa healthy lifestyle nyo. May exercise, may diet, gano'n. No? Okay?
Hindi po ako kumakain, Dok, ng mga mataba.
Totally?
Mantika.
Kahit na
Konti
konti?
lang to.
Konti?
Konti lang po.
Oo.
Opo.
Konti, okay. Pwede pa yun.
Mga prito, bawal. Hindi
Oo.
masyado.
Very good. Very good. Nice to hear that. No? So,
Opo, Dok. More gulay po ako.
very good. So, happy na ako kahit na konti lang yung ating mga attendees dito at nakikita ko yung mga takbo ng buhay ng mga nag-a-attend, healthy lifestyle, masaya na ako. Na,
Thank you, Dok.
okay. Okay. Wala na? Who was the other one who rose her, who raised their hands? Mga relatives. May mga relatives?
Can I
Sa akin po.
Sige, Abet.
what if your ultrasound is fatty liver and then your SGPT and SGOT enzymes are both high? Is it connected?
Depende kung gaano kataas yung SAST, SGOT, SGPT, gaano kataas. Depende. Na it could be variations, na pwede mo paulit na lang if you're concerned about it, no? Or as I said, kung wala kang nararamdaman at mild lang elevation, you just assume baka pwede at go back to your healthy lifestyle na. Okay. Para hindi, kasi mahirap na paulit-ulit yun kasi kung paulit-ulit mo yung test, ganun din no? Baka may mga errors din along the way. So just stick to a healthy lifestyle, diet, exercise, assume na meron, then i-reverse mo na kagad with your healthy lifestyle. Okay. So ako mismo, I don't do a lot of tests, but I just always assume na, theoretically, ina-assume ko baka mataas. I remind myself na dapat i-control ko with healthy lifestyle, healthy living. Ganun lang. Okay.
What is the difference between... Okay.
Again.
What is the difference between having fatty liver and cholecystolithiasis?
Fatty liver and?
Fatty liver and having cholecystolithiasis.
Cholecystolithiasis, bato yun. Bato sa abdo. Cholecysto is gallbladder. Lithiasis is bato. So, bato sa abdo yun. No? Okay. So,
when you have both of that,
you can have both of that. No? Meron kang fatty liver kasi because of your unhealthy lifestyle. No? And then you can also have stones also because of kadalasan hindi natin alam, baka sinasabi nila high fat diet kaya nagkakaroon ng stones pero hindi siya proven, no? So a lot of times you can have stones in the gallbladder at nagko-coexist dun sa fatty liver mo. No? Okay. So in the end, just stick to healthy diet and healthy exercise na lang, healthy lifestyle, no? Para to avoid the complications of fatty liver as well as kasi yung cholecystolithiasis, pag oily ang pagkain mo, kung minsan it will trigger a pain, masakit, no? Pero kung hindi masyadong mataba ang kinakain mo, pwedeng hindi naman sumasakit, pwedeng hindi mo pa opera. Just leave it alone. No? Okay. Okay. Any more questions? Sharing? Questions and sharing? Mas maganda yung sharing para ano, na. Hindi pa. So usually wala namang symptoms, okay? But with the advent, yung maraming nag-ultrasound left and right, may makikita talaga, no? Okay. Okay. May makikita, no? So once you have nakita yung fatty liver, mag-ano na lang kayo kagad, no? I-modify nyo kagad yung lifestyle niyo, no? Healthy diet, no? Okay. So pwedeng, pero once if you have, kung wala kayong diabetes, wala kayong hypertension, no? But if you have these other risk factors, you have to investigate further, no? Okay, so you have to do a liver function test, no? And then kung talagang mataas, you may have to do other tests like FibroScan, no? Ganon, no? Okay. So
FibroScan.
Di ko alam kung magkano yun. Paki-check nga, Abet, kung magkano.
Okay.
FibroScan, no? Kung magkano. Na-check mo na ba yung hepatitis profile?
I just got one diagnostic and that's Intercon. Yung complete hep profile is 3.2, so I wasn't able to get the others pa.
Magkano?
3.2, complete hep profile.
3,002. Medyo mahal.
Yeah.
Medyo mahal din yun. Anyway, tingnan natin kung pwedeng hep B and C na lang. I was thinking baka hep B and C na lang. Yung hep A naman, hindi masyadong
Yes.
Okay.
I'll check it on Monday again.
So any more? Anybody who wants to share and then we can learn more? Symptoms, medications, hypertension. Okay. So the other diseases that can cause fatty liver will be hepatitis also. No? Okay, hepatitis can also cause that. No? Usually in stones, yung gallbladder stones will not cause fatty liver. No? Iwalay yun, no? Separate yun. But minsan, if you have stones in the common bile duct, no, it can cause jaundice na paninilaw. No? So yung hepatitis, yung cirrhosis, pwede ding naninilaw. Kaya you have to differentiate the two. No? So once you have a person who has paninilaw, we have to determine is it obstructive, yung nagbabara, no? Or hindi. No? Yung nagbabara, yung mga due to stones, to the, kung may mga cancer, mga tumor, nagbabara dun sa may common bile duct, no? Yan ang cause of jaundice. No? Kung yung hindi man nagbabara, yung may sira yung liver, no? Hepatitis o cirrhosis, gano'n, no? Okay. So yun ang trabaho ng doktor to determine whether it's obstructive or non-obstructive, no? Okay. So a lot of times we can get the information from the ultrasound. Okay. Mas direct way of getting to the answer yung ultrasound kaysa yung liver function test, no? Okay. So you can do the ultrasound first. Kung may nakita ka ng bara, pato, you don't have to do the liver function na, no? Yung iba kasi sinasabay nila kaya mahal lumalabas na magastos, no? Okay. Okay. Any more? I see. Okay. Welcome, Feli. Feli is here. Nice to see you again, Feli. Would you like to share, Feli? Would you like to share anything?
No, I have nothing to share.
Okay. So, okay. So, malinaw ba yung explanation ko? Fatty liver?
Yes.
Yes, Doc.
Yes.
Okay. So, I'll try to reach out to other topics now. Okay. That's not really not my line, di ba? Surgeon ako di ba? Okay. Pero I'll try to reach out and try to simplify things, no? Okay. Of course, binabasa ko rin ng mga ibang yung mga writings na mga sa internet from abroad and also from the local, no? Kino-combine ko yung dalawa, no? Okay. Kaya medyo mahirap lang i-digest, no? Then I have to make it in a form that will be easily understood by you people, the lay people, no? Okay. Okay. So it's 3:08. Are there any more questions? No questions? Okay. Ano ba yung next week? We might go for goiter kasi goiter. We might go for goiter because yung sa Department of Health Awareness Calendar, now the third week of January, we try to observe goiter awareness, no? Okay. So one of the things that I'm going to follow this year is to consider yung DOH sa calendar, no? So sundan ko lang kahit yung kaya ko lang, ha. Okay. Okay? So, if there are no more questions, last call for questions, comments. Lana? Okay, if there are no more questions, let's call it a day. Okay, so goodbye. See you next week.
Thank you, Doc.
See you, Doc.
Bye-bye.
Thank you, Doc. Happy
Thank you,
weekend.
Doc.
Bye.
Bye.
Thank you, Doc. Thank you. Thank you.
Bye-bye.